My name is Michelle Cooper, and I am a social worker. My title at my job, I work at Hope Builders, and I work as a support specialist, which is also a case manager. In my 20 plus years of experience, I have worked doing mental health therapy for incarcerated youth at juvenile hall, and I've also done work with domestic violence victims.
Can you provide an example of a student who showed growth in their post-formal thought at the end of their program due to new experiences versus when they first started?
Sure. There's differences in our youth that come through our program. Some range from 18 years old to 26. So that in and of itself, when we have a classroom of students that come through our program, have different types of barriers. We tend to see that the ones that have just freshly come out of high school tend to struggle a little bit more. Some do pick up the pace depending on their experiences, how well they did in high school, versus the ones that have a little bit more barriers. Maybe they're young parents, they're living on their own, they're foster youth, they come with more trauma, they tend to struggle a little bit more, towards the end.
So in your class, you guys do scenarios. Do your students provide complex reasoning when answering to the scenarios?
Some of them are able to think critically and come up with outside the box, case scenarios that have real good substance as to they're on the right track, while others will tend to pull from whatever life experiences that they have and they'll draw their own conclusion. We like to look at, in their brain development, a lot of them are still growing and they're still developing, and so their ability to think critically is sometimes it sometimes throws them off a little bit in their ability to make proper judgments, especially those that are really young, that are maybe 18, 19, even 20-year-olds, that their prefrontal lobe is not fully developed and their ability to make those judgments are still a little adolescent. So their ability to make decisions in scenario cases, they might tend to struggle a little bit or come to a conclusion that may not be more mature.
Hi, my name's Chris. I'm a retired Navy air traffic controller, currently a air traffic control manager at an airport up in Los Angeles. Been an air traffic controller for 34 years.
Do you feel that your past experiences give you an advantage in problem-solving solutions you may face at work?
I do. My 20 years in the Navy as an air traffic controller introduced me to combat scenarios, environments that most people would not be exposed to normally.
Can you provide an example of how your acquired wisdom has proven beneficial for you at work?
Just different scenarios, from the president coming in to aircraft emergencies, things that I've seen over my 30 years, and the fact that we've been introduced to extreme stress levels for 30 plus years. Things don't seem to faze me near as much as I used to.
In your experience, do you feel that your controllers who have been with the company longer are more skilled versus those who are fairly new?
Well, we hire from a large base of retired controllers, a lot of military controllers. So locally, our local knowledge of the airport will be stronger with the more seasoned local area controllers. However, we bring in 20-year plus experience. So the foundational air traffic control is sometimes stronger, but the local can be stronger with the more junior people.
Hi, I'm Dr. Khalid Hassan. I'm a board-certified dermatologist, and I've been practicing for 9 years.
In your experience, what are some of the most significant cognitive declines seen in elderly patients 65 years and older?
So, The first thing I'd say is memory related. I'm not sure that comes as a surprise, but I find that older patients sometimes will forget the instructions we talk about, forget how to use a medication, forget how to apply a medication. And some patients who progressively have worse mental function will forget why they're here. They may not know why they're here. They'll always know a loved one who is with them, but they will tend to forget other things around.
It is said that environmental and cultural factors can contribute to cognitive decline. Do you find this statement to be true?
When I first read it, I thought no. But then when I thought about it, yes, in the sense that older adults need to be with other adults to be able to maintain their cognition. So I think it's more the social support and social structure. I'm not sure if it's directly related. I suspect it's more indirectly related. So having people around you fighting off depression, being in a better mood, feeling supported, may then improve the things you do, which then helps cognition.
Do any of your patients share examples of mental exercises they practice to stay sharp?
Stop right there. It's, yes, word puzzles, word games. I think more than the math games like Sudoku. So how many patients come in with the New York Times or the LA Times and they're filling out the word puzzles?
Yeah.
They finish one, then they go to the next one.
Okay.
Very common thing.